Good day. We are BSN 3E4B, composed of Eliana Ting, Villarete, Yanson, and myself, Miguel, Villar. And we are honored to present our study entitled Walking with the Community, Lived Experiences and Emerging Worldviews of Filipino-Foreign Nursing Students in Public Health Settings. Good day. We are BSN 3E4B. Nursing education plays an important role in shaping how future nurses think, feel, and respond to real-life situations, making this study significant in understanding how experiences develop empathy and awareness of health disparities. The study is relevant to Filipino-Foreign nursing students because their diverse cultural backgrounds influence how they interpret these experiences. Nursing education plays an important role in shaping how... The purpose of this study is to explore the lived experiences of Filipino-Foreign undergraduate nursing students and understand the emerging worldviews in public health settings.
This study used a terminological qualitative design to explore the lived experiences of Filipino-Foreign nursing students. The Filipino-Foreign nursing students' unique perceptions and experiences served as a vital data, providing the insights needed to understand how community exposures shape their emerging worldviews and professional identities. This study involved 8 third and fourth year Filipino-Foreign nursing students in Bacolod City. Eligible participants had completed at least 2 public health rotations, could give informed consent, and had lived overseas for more than 5 years. Participants were interviewed one-on-one using a semi-structured questionnaire, with follow-up questions as needed. After consent, their profiles including age, sex, years abroad, and countries lived in were established. Participation was voluntary, confidentiality was ensured, and support was available when needed.
Focusing on the first theme, walking through barriers, lived challenges in public health settings, participants encountered significant difficulties during their initial community exposure. These challenges mainly involve language barriers, cultural differences, and limitations within the healthcare system, all of which shaped their early clinical experiences. Under this theme, 4 categories were identified. First, strides in communication, focusing on linguistic barriers, where limited fluency in Hiligaynon hindered effective nurse-patient interaction. Participants expressed feelings of inadequacy as they were unable to fully connect or provide optimal care due to communication gaps. Second, finding footing, focusing on emotional disequilibrium, which highlights anxiety, uncertainty, and dependence on peers during early exposure. This reflects not only communication struggles, but also emotional and relational challenges in adapting to a new healthcare environment. Bridgeless walkways, focusing on healthcare system constraints, where participants were confronted with realities such as overcrowding, limited resources, and delays in care. These experiences revealed systemic gaps that directly impact both healthcare providers and patients. Lastly, unknown terrains, cross-cultural disorientation, where unfamiliar practices initially caused confusion, but eventually led to a deeper appreciation of community-based healthcare and local initiatives. Overall, this theme underscores how initial barriers are not merely obstacles, but critical learning experiences that expose students to real-world healthcare challenges, ultimately shaping their adaptability, empathy, and professional growth.
Focusing on the second theme, walking as becoming experiential, learning and professional identity formation. Participants gradually developed confidence, competence, and professional identity through active engagement in clinical and community health settings. These experiences are reflected in 4 categories. First steps that transform experiential learning as a catalyst for professional development, where hands-on tasks such as assisting in the delivery room, completing Worksheet C, and observing local practices fostered reflection, skill development, and independence. Second, guided pathways, relational and instructional support in clinical learning, highlighting how peer and instructor support eased challenges, built confidence, and guided participants toward autonomy. Third, walking with camaraderie, formation of therapeutic and social relationships, where empathy, active listening, and culturally sensitive communication facilitated trust and meaningful connections with clients and community. Lastly, meaning in motion, positive engagement in meaning-making in practice, reflecting how participation in health, education, home visits, and preventive care fostered personal fulfillment, reinforced learning, and strengthened professional growth. Overall, this theme emphasizes that experiential learning, combined with guidance, relational support, and active engagement, cultivates confidence, competence, and professional identity in nursing students.
Focusing on the third theme, walking toward awareness emerges of socially responsive worldview. Participants progress from initial uncertainty to deeper awareness, cultural sensitivity, and socially responsive perspective. Through continued immersion, they develop empathy, adapted the communication, and strengthen their understanding of holistic community health. These experiences are reflected in 3 categories. First, entering cultural humility. development of cultural competence and contextual sensitivity, where exposure to local practices and repeated interaction enhance cultural competence, allowing participants to connect meaningfully and provide respectful care. Second, echoes and footprints. Reflective appreciation and personal insight, highlighting how reflection fostered humility, gratitude, and recognition of personal and systemic differences, deepening participants' professional and personal growth. Third, community in motion. Recognition of community value and engagement, where engagement with community members and local health initiatives strengthen trust, collaboration, and commitment to patient-centered care. Overall, this theme shows that sustained community immersion fosters cultural humility, reflective insight, and socially responsive worldviews, equipping nursing students to deliver empathetic, culturally sensitive, and effective care. For our conclusion, language and communication barriers emerge as the most significant challenges, affecting both the quality of care and the participants' confidence. Yet the same barriers became catalysts for growth, pushing them to adapt, shift their mindset, and become more mindful of the community they serve, marking their initial steps in walking through barriers. With continued exposure and support from clinical instructors, peers, and community members, they gradually develop confidence, a sense of professional identity, and stronger patient relationships, reflecting their transition toward walking as becoming. Through their struggles and setbacks, they move further into walking toward awareness, cultivating socially responsive perspective, and recognizing nursing as a practice grounded in empathy, adaptability, and cultural sensitivity. Overall, community immersion emerges as a transformative journey that strengthens both clinical competence and perspective through continuous walking experiences.
Based on the findings of the study, the following recommendations are proposed. For school administrators, strengthen policies on cultural competency and inclusion, and allocate more resources for community health initiatives and student placements. For College of Nursing professors, integrate reflective learning activities to enhance public health understanding, cultural sensitivity, and holistic care. For Filipino-Foreign nursing students, engage actively in community settings and immerse in local language and culture to improve communication and care. For future researchers, expand studies with larger and more diverse samples beyond Bacolod City and explore long-term impacts of community health exposure.